So around the first time that I got diagnosed with kidney disease, I ended up on dialysis, man. You would scour the internet, you would talk to people about, you know, you're trying to find some sort of validation for how you feel, and you're trying to find some sort of understanding of like, okay, I'm not the only person that feels this way, right? But along the way, you're gonna meet people who claim to be experts that'll try to explain to you that they can anticipate when, you know, or they try to explain to you when that you can anticipate when you're gonna feel good or when you're gonna feel bad. That's not true. You cannot anticipate good or bad days. They come just like any other day. If you were a normal person, if you were a healthy person, they'll use verbiage like, oh well, you know, you could do this on your off days, or you could do that on your off days, or when you're not doing dialysis you feel fine, so you could just go for like a 10-mile hike, or, you know, go to the gym and lift weights for 4 hours. It's like, you, speaking for myself, like after a dialysis treatment, I don't feel like doing anything except laying down. A lot of it is because I simply just don't have the energy to do anything physically exerting. And there are long-term effects from being a dialysis patient. Even if you work out and you do all of that stuff they tell you to do, you're still losing proteins, vitamins, minerals. You're still losing nutrients. And your body, after a dialysis treatment, your body loses those nutrients because the machine takes it from you. You have to replenish those nutrients. And it's not a fast or quick process. It takes time. You know, you get these experts, social workers, doctors, nurses, technicians. They try to tell you, oh, well, on your off days, you can do all of this stuff. Oh, but you could travel and, you know, you could do all of this stuff. And it's like, I'm still recovering from the day before when I was on dialysis, right? I was talking to a technician in this dialysis unit behind me. I just came from dialysis, and he was saying, oh yeah, you know, you lay down for about 3 hours, you should be good after that. And I'm like, you have no idea what you're talking about. But of course he doesn't, because it's not him who has to do it. You know, it doesn't directly affect him or his house, right? Because I think a lot of it too is that they base their theories on how people feel on dialysis based off of a combination of, one, what people tell them, and two, the best patients that they have in the unit, right? So if you got Mr. Johnson getting off the dialysis machine and he's running out of the dialysis center so he can go run errands, they're going to think every patient is like that. For example, I have orthostatic hypertension. So my blood pressure was like 150 something over like 60 something when I arrived at the center, right? 4 hours and 15 minutes later, my blood pressure was like 100 over like 70 something. That's not good for somebody of my size. So I'm 5'11", 245 pounds. That's not good for somebody my size. And when your blood pressure goes down, your heart rate goes up to compensate for the lack of pressure. And that can put stress on your heart, which can lead to heart attack and weakening of vessels and muscles in the heart, which can lead to heart disease and cardiac problems. And I think to myself, you know what? I probably should correct this guy. But most of them don't really care either way. They're just trying to get to lunch, you know, or break or get off. And it's unfortunate that you get a lot of cats who, you know, they believe that they can anticipate how they're going to feel every day. And that's not, and then they put those opinions on a website, you know, and then like institutions like UC Davis or UNOS, they put those opinions on a website for other people to read while they're still trying to navigate like the beginnings of this. And then that sort of thing gets into your head, and then you start thinking to yourself, well, like, am I the only person that's tripping? Am I the only person this happens to? No, you're not tripping. I'm here to tell you that it's very common for people to randomly feel bad as dialysis patients. Just because you did dialysis the day before does not guarantee you're going to feel better the day after or even the day after that. It's just random. You do what you can, to try to alleviate some of the symptoms, but sometimes it's just going to happen and there's nothing you can do about it. So you just got to ride it out. And maybe you'll feel better tomorrow. Maybe you'll feel better 2 days later or whatever. Maybe the next treatment won't be so bad. You don't know.